COVID-19 has really changed our life, and we have to fight this disease over the last few months quite heavily, mainly in northern Italy where I work. We really had to face a very difficult situation. One of the issues raised is what to do with ARBs and ACE inhibitors, because most of these patients were taking these pills because of cardiovascular diseases. And someone was raising the suspect that given the interaction these drugs have with ACE2, the protein to which the virus spikes is binding, these drugs might in a way favor a worse outcome in this disease. Initial studies were providing conflicting data. Larger observational studies, however, came out with the evidence that there is no difference. Indeed, taking or not taking these drugs were not changing the mortality, but this was on an observational basis. In science, to be convinced, we need randomized trials, because randomized trials can help you avoiding the risk of bias, unmeasured confounding, inability to understand the pathophysiology behind what you are observing. And we have to compliment the authors of this trial because they were able to run a randomized trial at the time of the COVID pandemic, which is not easy. It was in Brazil and contribution from US as well. However, I was raising a few issues that might help analyzing this data better probably. Point number one, in my opinion, is age. In this study, they were including relatively young people. Average age was 55, and relatively mild, moderate patients. The mortality rate was only 2.7%, 9 deaths per group, those taking and not taking, because the design of the study was quite interesting. They were selecting people with COVID-19, treated with ACE inhibitors or ARBs because of a cardiovascular disease, all hypertensives. And they randomized them to continue taking the pills or to stop the treatment. The observation window was 30 days, and the outcome was being alive outside of the hospital at the end of these 30 days. And in this way, by selecting relatively mild, moderate patients, with such a low mortality rate, in my opinion, they could not really solve the issue. They were also unable to compare within the class ACE inhibitors with ARBs. They have a different mechanism of action, so they might provide with some different result, something to analyze. Additionally, they showed a tendency for those taking these pills to have higher percentage of people alive and out of the hospital, 95%, as compared to the group withdrawing the treatment, who had a 91.8% of being alive out of the hospital. I was just wondering what would have been the percentage in the two groups if they were considering older people higher risk with higher mortality. So my conclusion was that that's a trial important because it's randomized, probably is not telling us the very last words. It would be nice to consider the interaction between age, comorbidities, and these treatments. That might tell us more. But certainly a general methodological conclusion, I think we need randomized trials. Probably the best way to organize a randomized trial is to start from an analysis of the good observational studies, which can teach you how to design the randomized trial.